Good morning, everyone. In recent weeks, in conjunction with this conference and also related to the demise of Bernard Lewis, I found myself thinking quite a lot about the genealogy of knowledge and academic practice. If had to present the Mühimme as a gold mine for Ottomanists, and Amy discussed that yesterday. For us, 50 years later, entry into the archives and libraries is obvious and routine, both in terms of methodology, but also in terms of practical accessibility. But thinking of the change in practice among modern Ottomanists allows me to think more clearly, I think, about the patterns and irregularities in science, in the ways that pre-modern Ottomans taught medicine, studied medicine, researched medicine, and practiced medicine. For that reason, I devoted the pre-circulated paper to discussing the variety of health practices in Ottoman Palestine to note three issues. One, the broad range of practices and practitioners related to body and soul. Number two, medical care prior to the 19th century reforms was largely an individual's initiative. And number three, Ottomans indeed tried to advance their health based on their understanding what health was and what medical measures were respectable and acceptable. Points number 2 and 3 is the issue of monitoring well-being, and this is what I'd like to highlight in this presentation. I'm studying the ways that Ottoman medicine, in its broadest sense, was controlled and regulated in the early modern period, at least to some extent. I'm less interested in how it happened, but rather focus on the social and cultural meaning of the growing state control of health. I suggest two paths to looking at meaning of regulation of medicine. One path is a focus on the growing involvement of bureaucrats in the regulation and standardization of medical practice. That means that since the 16th and 17th centuries, there was a growing involvement in medicine of a new cadre of people, namely administrators and court officials. During the discussion, I'd be happy to give some examples. At any rate, never before were administrators so prominent, influential, and visible in the realm of medicine. They had no claim to medical education and knowledge. Their authority in the medical realm rested with the formal office rather than personal qualifications. Another path is to look how the growing involvement of bureaucrats impacted more than medical practice, the medical institution, the apparatus of medical monitoring, and the state. At the kernel of medical practice was, and still is, a social moment of meeting of patient and healer. Prior to the monitoring shift, patient-practitioner encounter was personal, private, and intimate. Now the meeting of two included a third wheel, the bureaucracy, who spoke on behalf of the state and the so-called public. There were several subtle mechanisms of selecting and cataloging medical knowledge and practice as either honorable, tolerated, or dangerous. Learned treatises were one arena. This is where physicians and religious leaders debated and discussed theoretical and moral aspects of medical knowledge and practice. The marketplace was another arena. This is where paying customers of health could directly negotiate with health providers the medications and services in the medical realm. As in the market, materia medica was bought and where many healers offered their services. The legal court was a third arena, and this is where laypersons and healers negotiated through the court quality and costs of medical health. The example I bring today not mentioned in the pre-circulated paper, is Raphael Mordechai Malki, a rabbi and physician from the second half of the 17th century. He was an Iberian Jew who migrated to Jerusalem in the 1670s, where he practiced medicine and wrote about it. Malki apparently graduated from a European university, a fact he was particularly proud of. Malki wrote a treatise devoted to medicine, which was probably lost, but nevertheless, in the 1690s, he devoted himself to composing a vast encyclopedia-like Torah commentary, encompassing all the branches of knowledge Malki knew: astronomy, geography, history, Kabbalah, and medicine, including pharmacology and anatomy. The text included in Malki's agenda was of reform and improvement of the Jewish community, especially in Jerusalem. And here I cite Mina Rosen, who wrote about Malki and said that Malki's position gave him the privilege to criticize, sometimes even harshly, the Jewish community in Jerusalem. Throughout the long text, one finds many comments about medicine and medical practice. He denounced healers who were, in his eyes, charlatans. Ottoman doctors held the adjectives ignorant and dangerous at each other, when in fact it was a personal disagreement between them, a theoretical medical argument or professional struggle that led them to denounce rivals and competitors as frauds, even when the adversaries may have been skilled professionals. As a university graduate, it seems plausible that a physician like Rabbi Malki would look down at most local physicians in Jerusalem, a small provincial Ottoman town. Malki's criticism reads like a privileged physician trying to keep his privileges. We find this kind of rhetoric in the Muslim world and Christian Europe since the medieval period. In that regard, Malki's text isn't something that we haven't seen before. However, Malki's plan for standardization in medical practice is the product of Ottoman times. His call for standardization is part of the reforms he wished to introduce into the Jewish community in Jerusalem and the medical profession in particular. One component of medical reform was the introduction of autopsies. Malki suggested that if someone passed away without an apparent cause, while under constant medical attention and treatment, physicians may operate on the body in order to establish a concrete cause of death. But according to Malki, not every physician was entitled to decide about an autopsy for himself and carry it out alone. A consensus of 3 physicians must emerge about the need for autopsy in each specific case, and the deceased's relatives must give their consent. Malki added that autopsy was not to be performed on certain groups. Not surprisingly, all belong to the elite, important personalities, the rich, and famous scholars. Malki was an erudite scholar, but his writings on medicine were informed by his busy and successful medical career within the Jewish community in Jerusalem and beyond. He was summoned to treat Jewish leaders of both the Sephardi and Ashkenazi communities. His clientele, however, included the Ottoman administration of Jerusalem as well. He was also well connected to the Christian communities in Jerusalem. He was the private physician for various convents, for example, the Armenian monastery. What we have here then is a 17th century Ottoman physician's call for reform in medicine, and he points to very specific components of the field. In the passages related to autopsies, Malki talks about medical diagnosis and medical ethics. But I'd like to highlight that Malki's advocacy of autopsy envisions also a new type of relationship between a physician and his or her patient. Malki describes the physician's commitment to the patient, and this commitment continues even after death. This commitment includes understanding the true cause of death on the one hand, and respecting the patient's social status on the other hand. However, the relationship between patient and physician isn't just theirs. There are others who have a stake in it. Malki mentions the role that other physicians may have and the rights of family members to determine a medical course of action. We see how already in the early modern period the right to medical treatment and autonomy over one's body were in the public eye. To conclude, medicine has always been part of the public interest. Then, as now, there's no shortage of individuals and groups who deem themselves as gatekeepers of the public interest. Today we accept the premise that physicians don't have the exclusive right and authority to determine what recognized and conventional medical practice is. Administrators, funders, insurers, politicians, they are all players in the medical arena. The Israelis among us may remember the mayhem in the Wolfson Hospital in Holon since 2016 till earlier this year. The legendary director retired, and the Israel Medical Association with the Ministry of Health tried and eventually succeeded to prevent the appointment of a director general who was not a physician. Their success in this case highlights how, in fact, physicians have limited monopoly over medicine in our time and age. Now, of course, we can make the claim that physicians never had monopoly over medicine, and they always had to negotiate with someone else. But if we look at the broad process in the medieval period or late medieval period, and I think about the Ayyubid times and the Mamluk times, physicians had to negotiate with patients who, because they were the paying customers, could negotiate with physicians about the course of action. But from the Ottoman period, 16th century onward, we see that it's not necessarily the patients who negotiated with physicians. In addition to patients, it's also administrators, court officials, people who, because they held a certain office, could dictate or at least monitor to some point the medical course of action. Ottoman medicine of the early modern period, cases from the sigils, treatises like Malki's, are all important to reveal how this process of bureaucratization in medicine started. Thank you very much.